Hi, my name is Dr. Wellens with Central Florida Foot and Ankle, and I'm going to talk to you about a disgusting topic of plantar warts. So probably one of the most frustrating conditions that I see, and of course, patients always ask me how come I don't put them on antibiotics. Well, a wart is a human papillomavirus, so antibiotics don't work on it. In fact, there is no oral medication that is FDA approved to work on warts. And that is why the only way to get rid of them is to destroy them. So what does like this destruction thing means? It means we can either laser it, we can cut it out, we can use a chemical, or we can freeze them. So on the bottoms of the feet, usually freezing does not work. It's just the skin is so thick and the cryopen does not penetrate the plantar aspect of the foot, the bottom of the foot. So I get a lot of referrals from dermatologists and pediatricians where, again, they're pretty frustrated because it works everywhere else on the body, but it doesn't work on the bottom of the foot. So what do we use? We use different chemicals and there's different strength, and we give patients homework to use chemicals at home. But believe it or not, sometimes it still does not work. So what do? We can definitely laser them out, which most of the time the laser has to go pretty deep, so I will have to numb you up, which is not the most pleasant thing, but it's doable, and it can be done in the office. But a lot of patients come in for, second or third opinions, and they're like, listen, doc, I'm here, just please cut it out. So the exciting thing is this. In the old times, we used to just cut them out, and we would do it either in the office, so we can do it at the surgery center where we can go a little bit wider and a little bit more aggressive. But both techniques involved local anesthetics, which means that you will have to be numbed up, and a lot of the times it's very painful and unpleasant. Especially, can you imagine getting a needle on the bottom of your foot? I mean, this is not the most pleasant experience. But now we also have a new technique called needling. Yes, from the word needle. So it still requires some anesthesia, but instead of creating like a large hole on the bottom of your foot, basically a physician takes like a needle and penetrates through the skin. And what it does is it introduces the virus into the deeper layers, and then your own body produces antibodies to basically reject the wart. I mean, it's a pretty smart idea. It was actually originally popularized like in the 1940s when they didn't like really have a lot of medical knowledge behind it. But now we have this new needling technique. So the reason why I'm doing this video is, how I always talk about new medical technology is there is something new that is out there that we didn't have a couple of years ago, and there's finally research that is published on it. So if you are a person who is embarrassed, who've been to like dermatologists, podiatrists, and you did not have any success, or I even see a couple of patients a week that had it surgically resected somewhere else and they come in because it did come back, give us a call, because definitely needling is something that is very popular in the podiatry world and the wart world, because it is a very frustrating condition and it's very embarrassing. And a lot of my patients, they are afraid to go to public pools or, Disney World or Sea World because they don't want their feet exposed, because it is a very embarrassing condition. So give us a call. I have something new for you.